next attendee today, Mike Galardini, who's the sales executive with JRG Advisors. As you know, they operate our PBIP program. Michael's a 1999 graduate from Duquesne University. He has a Bachelor of Science in Business Administration, Concentration Management. He is a licensed life, accident, health, and fixed annuities guy, so he has a lot of letters behind his name. At JRG, he supports them by focusing on meeting the needs of employers who struggle to balance health insurance costs with coverage needs. 10 years of experience, he helps clients providing additional services through JRG strategic partnerships that include financial planning, human resources support, personnel, and business property insurance. Specifically, I think in our planning group for this day, what we're looking for today, and I hope Michael touches on it, and we'll be sure to hold his hands to the fire, are two parts in my mind. One is understanding what PPACA is going to do from the employer point of view, but also from the employee point of view, because we're going to be called on to be able to help solve and answer some of the questions from both perspectives. I think also, for Michael's sake, I'd like to point out that most of our members are much less than 50 employees. So the focus here is going to be on that perspective, I believe, particularly since the delay. But Michael, if you'll make sure that we touch on both those, that'd be great, and thanks for coming today.
Thanks. Well, if I look a little awkward, I just thought I'm being taped today, so I usually walk around the room and talk with my hands a lot, so I'll figure it out as we go. I appreciate the introduction, Jim. I also wanted to mention that Rick Galardini from JRG Advisors is here, Albert Horn, and Mary Spiker. So after this, if you have any questions pertaining to what we talked about today, all four of us will be able to help you, and throughout the weekend as well. So Jim, actually that was a great segue, because what we are going to touch on today is all three aspects of what Jim just talked about. We're going to talk about the effect of PPACA on groups that have under 50 employees. We're going to touch on the effect that PPACA is going to have on over 50 employees. And we're going to see today that even though the law is delayed, which we'll get into, until 2015, there's a lot of requirements that need to happen before a group goes into being that status of over 50 and have to abide by the legislation laws. And the most important part of the bill that is still going to come out January 1st, 2014 is the individual mandate. Is that if you are a citizen of the United States, you're going to be required to have health insurance, or you're going to be fined for not having a health insurance product. So what I'd like to do is, with the first slide, is just review what we're going to sum up today throughout the presentation. Some of these points, as Jim mentioned, are going to be for a lot larger groups. I probably will skim over that because, as we know, most of the membership in the locals and through PBA are smaller, under 50, so to speak. So, you know, if I'm going too fast on those, please just let me know. Also, during my presentations, you know, I keep it pretty relaxed. So if you have a question, raise your hand. You know, I can answer that, or someone else from the JRG team can help you out. Can everyone hear me okay? Good. So first, we're going to talk about is what has come out in 2013 through PPACA. The first thing that's come out is W-2 reporting is now going to be required for companies. You only are going to have to report for W-2s if it's greater than 250 employees within the group. So if you have under 250 employees, you're not going to be required to have the W-2 reporting. We saw that women's wellness came out. These are going to be services that are going to be covered at 100%. You probably saw in the media there was some fighting going on back and forth. Some groups thought that this was necessary, some groups were against that. So we're going to talk about the services that are covered at 100% for a woman, where they would not have to pay anything towards that medical service. Some fees we're going to talk about today. One that has come out is called the Patient-Centered Outcome Research Fee. This is where insurance companies or plan sponsors, if you're self-funded, such as a health reimbursement arrangement, are going to be required to pay this fee. I think it's very important to realize that even if if a group is fully insured, if they have an HRA, that's a self-insured plan. So they would be responsible for this patient-centered outcome research fee. And I'll get into more detail of what that means. We also have, now that came out September of last year, the summary of benefits and coverage that insurance companies are required to provide. Most groups have seen this already because they have renewed. We only have a couple groups going in the fourth quarter that have not renewed yet. We've seen this historically in the past. These are your benefit grids, so to speak, that you would get as an employee, and it would tell you what the plan says. What the government has come out and said is they want more detailed description of the plans. They want the average American that is not an insurance professional to not get confused of what their benefits are. And I'm going to go into more detail of what that summary of benefits and coverage has to look like. One very important that's coming up very quickly that an employer is going to have to provide is the Employee Coverage Options Notice. We'll get into more detail with that. A lot of employers don't realize that they have to provide this, even if they're not providing health insurance. And as an employer, you have to provide this by October 1st of this year. And again, getting into more detail later on that. We're seeing now they're limiting health flexible spending account contributions to $2,500 for the plan year of 2013. Is everyone familiar with what a flexible spending account is? Okay. If anyone is not, I can go over that very quickly. You're going to see some numbers in red, as you see here, the $13 billion over 7 years. When PPACA came into law, as they do anytime, the Congressional Budget Office is required by law to budget over 10 years. So we are now 3 years into the legislation. There's 7 more years left on that budget. So when you see these different items, this is what the government is hoping to raise over the next 7 years. So with the limiting health flexible spending account contributions, they're looking to raise $13 billion to help fund healthcare reform and PPACA. There's going to be increased threshold for medical expense deductions from 7.5% last year to now 10% this year. What this means is if you're an individual, when you go to file your taxes under the age of 65, you add up your medical expenses that you had for the year, and in 2012, if that was more than 7.5%, you can take a deduction. Coming up in 2013, it's now going to be 10%. I was pretty happy last year, mine was 7.4, so I wasn't able to take a deduction. There's going to be an additional tax on the Medicare portion of FICA for high-wage workers for 2013 tax year. They define the high-wage workers, and the increase is going to be 0.9% on wages over $200,000 for an individual and $250,000 for couples filing jointly. This is based on earned income that is applied to FICA. That's where the 0.9% on wages is going to be taxed. Also, there's an additional 3.8% tax on net investment income for these individuals. And on the net investment income will be items such as stocks, bonds, mutual funds. And as you see with the numbers there, the government is hoping to raise $210 billion over the next 7 years. What we normally tell clients in groups when we're working with them is you always want to consult your tax advisor to find out where you stand with these changes. Now, I did mention a little bit about women's wellness. Women's wellness was effective for non-grandfathered plans for plan years beginning on or after August 1st of 2012. Now, a non-grandfathered plan is a plan that has made any changes of some size, of some substance to your plan since March 23rd of 2010. What I mean by that is, as an employer, if they made a change to their deductible, to their copay structure, that means your plan is no longer grandfathered. What we normally find in the industry is that most employers every year, due to the cost of health insurance, are changing these items within their plan. They're changing deductibles, they're changing copays. So we don't find too many groups in the industry that still have a grandfathered plan out there. There are some, but most are in the non-grandfather status. So you'll see these type of changes that are happening because of PPACA are happening to most groups. With the women's wellness, its in-network cost sharing is eliminated for expanded list of preventative care services for women, including prenatal visits, additional gestational diabetes screening tests, lactation support devices and counseling, FDA-approved contraceptive methods, STD counseling, HIV screening and counseling, and domestic violence screening and counseling. So for any of those services, there's no cost sharing for a female. It would be covered at 100%. I did talk briefly in the first slide about the patient-centered outcome research fee. The best analogy I've heard so far about this new program the government has developed and the fee that's attached to it is if you've ever gone and got work done on your car, and the mechanic or the body guy goes behind and picks up that big book and comes out and tells you, what it's going to cost to fix your car. Well, that's what the government is doing to decide what the right cost for certain medical services should be, the appropriate charge for that medical service. So what they had to do to set up this program is create a fee to fund it. And this fee created to fund the fee is created to fund the Patient-Centered Outcome Research Fee Institute. It's established to research the clinical effectiveness of medical treatment, procedures, and drugs. Basically, best practices, so to speak, for those services. The fee for plan year 2012 was equal to 1 times the average number of lives covered under the group plan. If it's a fully insured plan, the insurance company is responsible for this fee. If it's a self-insured plan, such as an HRA or a self-insured program, then that is where the employer will be responsible for that fee. The fee for plan year 2013 is equal to 2 times the average number of lives covered under the group health plan. And the fee for the next 5 years will be indexed. As I mentioned, plan sponsors, insurance companies, or employers, if self-funded, are required to file Form 720 annually. This form is just simply an IRS document. And that 720 form is due July 31st, 2013 for 2012 calendar year plans. So that's when they would have to file that form to show how much they would owe for the 2012, which was 1 times the average number of lives. And as we see, they're looking to raise $2.6 billion over the next 7 years. Before I go into some of the other fees, what we've analyzed, in the marketplace is when you see anything that says that the insurance company is responsible for that additional fee, we really believe that that fee is going to be passed on into the rates to the consumers and to the employers. That's what our analysts and our consultants have seen, and we've already seen that with some of the preventative services that came out, where preventative care is now covered 100%. I think in the first year, they said that raised premiums about 2 to 3% to now have preventative services covered 100%. Are there any questions so far? Everyone still awake? Okay. I did mention about the summary of benefits and coverage. I compared this to the plan grid you get from your employer as an employee. Effective for open enrollment period on or after September 23rd or 2012, the insurance company is responsible to provide to the company, to the group, to provide to their employees the summary of benefits and coverage. What it does is it establishes standards in 4 areas: appearance, language, form, and content. Language standards include easily understood terms and availability of language assistance in non-English languages. Form standards deals with rules of paper and electronic forms. Content standards include uniform definitions, a description of the coverage including cost-sharing exceptions, reductions, limitations on coverage, and coverage examples. And I did skip over one that kind of makes me smile a little bit because that's how detailed they are about what the SBC needs to look like, is that it has to include 12-point font and 4 double-sided pages. And that's what it has to be when you provide it to each employee. Again, these are provided by the insurance companies for fully insured plans, and the Department of Labor released an updated template in April 2013 to be used for plan years beginning in 2014. Okay. The employee coverage options notice. This is one we find a lot of employers don't understand, that even if you don't provide benefits currently, you still have to provide this to your employees. And what this notice must inform the employees is that, one, an exchange exists, including a description of the services provided by an exchange, and how employees may contact an exchange to ask for help. So basically, you have to let the employees know there's an exchange out there, and what is involved with that exchange, and how to get help to purchase products on it. Yeah, Jim?
Exchange being public exchange,
yes,
or private exchange, or both?
I believe it would just be for the public exchange. Yes. If the employer plan's share of the total allowed cost of benefits provided under the plan is less than 60% of costs, they may be eligible for a premium tax credit and a cost share subsidy if they buy a qualified health plan through an exchange. It's a lot to be said. Basically, I'm going to get into this a couple slides down the road here in the presentation. If an employer offers a plan where an employee has to pay more than 60% cost sharing for their benefits. Now, is everyone familiar with what co-insurance is in a health insurance plan? You know, where we all live in the state of Pennsylvania, you hardly ever see an employer offering a plan that has a 60-40 cost sharing, right? 60 where the employer is responsible, the insurance company is responsible for, and 40 where you as a member are, okay? This is the 60% rule, which I'll get into, is the bronze level plan on the exchange. If you as an employer offer a benefit that requires the individual to pay more than 60% towards their benefits, then they could qualify for a subsidy for the public exchange or a tax credit. And I'll get into a little more detail as we go through the presentation.
How do employers get a hold of this information and these requirements? Where is that coming from?
Dad, you want to touch on that?
Well, I mean, the actual, what we're going over right now is the pro forma format that has to be in writing in the hands of every working person no later than October 1st. So
Every working person or every business?
Every working person. The business has an obligation to give it to them, whether they provide insurance or not.
Okay, so my question is, how does the business become aware of what the obligation is? Whose responsibility is it?
The IRS is now mailing to every EIN business, if you will, this requirement.
Okay.
And what it must look like, and a sample model notice of what it physically should appear to be in the hands of.
So the feds have the requirement to make sure the employer knows what they have to do. Right. Thank you.
Right. And typically, the brokers and agents and consultants are putting this together as a value add, if you will, to those employers.
Right, but the obligation is not yours, the
right,
obligation
it's the employers.
Okay. Thank you.
All right. Any other questions on what Jim asked? Okay. If employees buy a qualified health plan through an exchange, they may lose the employer contribution, if there's any, to any health benefits plan offered by the employer, and all or a part of the contribution may be excluded from income for federal income tax purposes. Basically, if an individual goes to the exchange and purchases a product, a qualified plan on that product, and the employer was offering something to them, they lose that. They no longer have access to that because they have gone and purchased their insurance through the exchange. The Department of Labor is expected to issue additional guidance late summer or early fall of 2013 for these notices.
So, I'm sorry, I'm still hung up here. Okay, so whose responsibility is to let me, the individual, know about that possible potential loss?
The employer.
Is the Fed's going to mail me something?
The employer is responsible to provide it to the employees to let them know that the exchanges exist.
Okay. So let them know the exchange is there.
Right.
Do we also, now I'm an employer. Will I as an employer tell them they could lose my benefit if they go
Part
to
of
the
the-
exchange?
It's part of the-
It's part of the notes.
Okay, okay.
Yeah, the language in explains that to the individual. So what we normally tell employers is, bare minimum, your requirement is to provide this to the employee. Then it shows them where they can access the exchanges. There's websites, there's guidance they can get from the exchanges, the individuals that are going to be working on them. Also, we really believe the broker community is now going to have to adjust and be able to help employees at employer groups, guide them to the exchanges. So that's going to be a big part of an agent or broker adapting and understanding the exchanges and guiding those individuals to them. This next slide is based on what the big splash just came out, where the administration has delayed the penalties for groups of over 50. What they simply have labeled this is it's called pay or play for employer requirements. If you're an over 50 group, you have a decision. You can pay penalties and fines, or you can play and decide on what type of plan design, what type of contribution, we'll get into that in more detail, to meet the government's requirements to provide benefits to your employees. Employers with 50 or more full-time equivalent employees are impacted. And the IRS Safe Harbor is offering to 95% of these employees and dependents under age 26. Spouses aren't included when you do these calculations. It's the employee and the dependents under age 26. As I mentioned, on July 9th, 2013, the IRS formally issued a delay of the enforcement of the shared responsibility, penalties, and information reporting requirements until 2015. Unclear on how the new deadline impacts transition relief for non-calendar year plans. When we're saying about the information reporting requirements, I'm not sure if you've heard, one part of the delay is not only on the penalties for the over 50 employer groups, it's also now for individuals. They're going to go on the, basically on the honor system when you're going to apply for the exchange to get a subsidy. So if I, Mike Galardini, want to go to the exchange, they're not going to require any reporting to justify what my income is. It's going to be the honor system for year 2014. And they're just going to trust the individual to go on there and report their correct income. And that way they can tell them what subsidy they'll receive from the government. That was another big change that came out. The key to prevent full-time employees is from getting a subsidy in the exchange. That's the key. I'm going to still talk about the penalties because I think it's important. The key is just to prevent full-time employees from getting a subsidy in the exchange. An employer's obligation can be summed up as two things: the availability they have for the health insurance plan and the affordability they have for the health insurance plan. The law defines full-time as working 30 hours per week. So if your eligibility is at that level, you satisfy the availability requirement. What we find is most employer groups don't classify full-time employees as working 30 hours a week. It's usually more than that. So that's what you've heard, the big disruption and the stir, is that a lot of employers are now saying, wow, now I have to offer coverage to my employees that work 30 hours, and this could take me up over being 50 full-time equivalents. Now I have to abide by the availability and affordability rules to justify what the legislation says. A plan is considered to pass the affordability requirement if a full-time employee has to pay no more than 9.5% of household income for single coverage. If they're paying more than 9.5% of their household income towards their premium, it's just towards premium. Doesn't count deductibles, co-insurance, co-pays. It's the cost sharing on the premium. If it's greater than 9.5%, then they could receive a subsidy from the exchange. Sure, Deb.
So, full-time employee, no more than 9.5% of household income for single coverage. Hypothetically, that could be two 27-year-olds, and both of their incomes would come into play.
That's correct.
Okay.
That's correct. Now this is what I mentioned when I first came up to talk, that we really believe that even though the penalty requirements are delayed till 2015. You're going to see here that for a group to decide if they have over 50 full-time employees, there's a lot required to do that. So, you know, what we really believe in the industry is, wow, some employers, you know, can go like that with their brow because they were getting so close to the date coming up, January 1st, 2014, they weren't sure of where they were at. You know, if they were over 50, what they were going to do with their plan design, with their contributions. So next, you know, 18 months or so, at least going into the year of 2014, these are where, you know, the important items for these groups are going to be important. The stability or measurement period states that the IRS says that all employees under common control are treated as a single employer. This is a big thing. If you have individuals that own multiple companies, okay, and let's say they have 10 employees in this company, okay, 10 in this company, that's 20, right? And then 31 in the other company, they have over 50 full-time employees. That's how they consider that. So you have, and if you have common ownership within those, common control, that's considered one group. So there's a lot of business owners that think they don't have to worry about the over 50 rule, but if they have common control in multiple companies and they add up to over 50, they have to, you know, abide by the affordability and availability part of the act.
What about seasonal employers?
I'm going to get into that.
Oh.
Seasonal employees, they have a rule for that if it puts you over 50. For each month, to develop this, you're going to track the number of employees regularly scheduled to work 30 hours per week. You're also, for each month, going to track the number of hours each part-time employee works and divide by 120 to calculate the full-time equivalent employees that they would have. That would make you decide if you have over 50 full-time employees by those calculations. What you'll find is a lot of brokers and agents have calculators to help employer groups with this. Carriers have them out there. I've even seen payroll companies like ADP, Prime Pay, they have calculators out there to help employers decide if they're at the over 50 threshold. And then once you get that number, you're going to add up the number of full-time and full-time equivalents for a 12-month period and divide by 12. I'm sorry, I forgot that fact. Let me go back. So you look at the total number of employees regularly scheduled to work 30 hours per week. Then you also take the number of part-time employees, their hours, divide by 120, divide that number by 12. And so Deb's question, if the only reason you exceed 50 employees was due to seasonal employees and you did so for no more than 120 days, you can ignore those seasonal employees.
So therefore, someone who's doing part-time seasonal, if they cut them off at 29 hours per week, they don't. I'm thinking like landscapers and so on and so forth.
Well, that to your point, that's a big talk because a lot of large companies are now telling their employees once you clock in at 20 to 29 hours, you're done for the week. To avoid getting to that having to pay for their benefits and then put a contribution towards their benefits. So you also, to your point, Deb, yes, I mean, if they're getting to a point where they're considered seasonal and now moving into part-time or full-time status, you know, they could decide what they would want to do with that employee. That's a big controversy. And I really believe that's why you see the delay in this over 50 rule. Promise, Jim, we're getting past the over 50. So very quickly, the penalties for the over 50, once it does come into play in 2015. Penalty A states employers that do not offer coverage to substantially all full-time employees, which will be that 95% IRS safe harbor, will be subject to a penalty equal to $2,000 per full-time employee minus the first 30. Let me explain what that minus the first 30 means. When you're going and you look at how many full-time equivalents you have, let's use my number 51 that I used previously as my example. You have 51 full-time equivalents. You can minus your penalty the first 30. Does that make sense to everyone?
They pay 20, penalty on 21.
Right.
Just to get our heads around this full-time equivalent, so if an employer has no full-time employees, they have 100 employees that work 29 hours per week, well, let's say 102 to make the math easier, they still would be considered over 50 full-time equivalents?
Not if they're working 29 hours per week. They're under the 30.
Yeah, but didn't we say we had to add all of the hours up and divide by 120? So essentially, we're not looking at each employee individually, we're looking at the group.
Yeah, that would be a correct statement. So yes, I'm sorry, let me retract that.
So even though I don't have one full-time
That's
employee,
right.
not even one, I'm still over 50 in that scenario because the hours all adds up to FTEs, full-time
Right.
equivalents.
I've actually had the example from a consultant in our office, Chuck Whitford. He gave me the example that if you have 6 part-time seasonal employees or part-time that work 5 hours of work, 5 hours each a week, you have 1 full-time equivalent. So I think that kind of sums up what your question is. That's how he explains it to me because he's a lot smarter than me to dumb it down to my terms. But yeah, that's to answer your question. Yes, you could potentially be over 50 with that example. Penalty B states that employers that do offer coverage but is either not of minimum value or not affordable will be subject to a penalty equal to $3,000 for every employee who receives a subsidy coverage through an exchange. So that goes back to the availability portion of the Act and affordability, okay? If the availability doesn't meet the requirements and that employee can get go to the exchange and receive a subsidy, you're going to be fined $3,000 for that employee and everyone that goes to the exchange to receive a subsidy.
So what happens in the case of an employee who obtains a subsidy and falsifies their earnings?
That's a great question.
Have they developed a penalty for that instead of employee?
In 2014, it's on the honor system. In 2015, there's going to be reporting requirements. If they go receive a subsidy and you meet the obligations as an employer, it goes back to they cannot have that health insurance plan. So it is, as you see, it's going to be kind of muddy waters for 2014 with going on the honor system. We could see a lot of individuals receiving a subsidy on the exchange. Okay. Now, for the pay or play determining who has to be offered coverage, we went through this a little bit, so I'm going to skim through this very quickly. The mechanics of offering coverage to all full-time employees. This is what I mentioned, even though the over 50 penalty portion is delayed till 2015, you're going to see what an employer group has to do could be a full year to decide where they stand as an over 50 group. The testing period is a 12-month period to determine whether an employee has averaged 30 hours per week. That will be your testing period to see if they are working 30 hours per week. After that will be the sign-up period. What we find nowadays, this is also what we call in the industry the waiting period. When a new hire comes aboard and they have a waiting period until you're eligible for benefits. Well, through PPACA, the maximum you can have for a waiting period is now 90 days. We have a lot of employer groups that have longer waiting periods before their employees are eligible. So the sign-up period states at the end of the testing period, then after 90 days has ended to identify and enroll those who qualify for the next plan year. So you have the testing period 12 months. If they are over 30 hours, you can have a waiting period of 90 days. On that 91st day, they get coverage. And the coverage period is simply that next plan, the plan you were talking about after the 12 months plus the waiting period.
Now, how does that affect, it's been a standard in the industry for forever that plan months begin on the first of the month. So what happens when the employee started on the 3rd, then they're actually at more than 90 days is my point. Do you have to wait till the new month rolls around?
It has to be on the 90th day. The
So
government,
that's going to change the whole insurance industry on that respect.
The government even states that if it's a holiday, you can do the 89th day. You can't do the 91st day. So you cannot go over 90 days. So you could have effective dates all throughout the month. It could be different days for everyone. New employees who are expected to work full-time must be offered coverage, and I just stated this, as you can see. I don't need to read that again. New employees with variable hours are subject to their own unique testing periods from 3 months to 12 months. So for your seasonal employees, your employees that have variable hours, your testing period can range from 3 months to 12 months. Okay. I touched a little bit on common ownership. Basically, when we get to this part, what we like to tell individuals is to consult with an attorney to decide if common ownership does exist. It can get very convoluted, so we want to make sure that they get the appropriate information to decide if there is common ownership. What it states is all employees of a controlled group of businesses under IRC sections 14B or C are an affiliated service group under code section 414M and are taken into account to determine if an employer is subject to pay or play rules. It really goes back to what I had mentioned. If you have multiple groups, multiple companies, and you have, as my example, 10 full-time employees, 10 full-time employees, 21 in the third, and there's common ownership, common control, you would be subject to the pay or play rule. For the purpose of calculating the amount of the availability penalty, each member of the control group is treated as a separate employer, and the first exclusion, the first 30 exclusion, is prorated among the members based on the number of full-time employees. So when you look at the availability, to decide full-time equivalence, it's when you add everything up as one group, okay? The penalties phase, in which you look at the availability, would be based on each individual employer. Employees don't include leased employees, sole proprietors, partners, or 2% shareholders in an S corporation. Those will not be considered. Okay. The main part of the PPACA bill that is, definitely going to stay as it states right now, coming effective January 1st, 2014, is the individual mandate. When I stated earlier in our conversation, the individual mandate states if you're a citizen of the United States, you have to have health insurance, some type of product, or you're going to be fined. The penalty for not being enrolled in a health plan is the greater of, for 2014, $95 or 1% of your income. So the greater of the two, $95 or 1% of your income is what you would be fined for the year if you don't have a health insurance product. We believe that most health insurance costs more than $95 or 1% of your income. So it's going to be a decision on that individual if they want to get health insurance. 2015, it increases a little bit. It's $325 or 2% of your income. 2016, it's $695 or 2.5% of your income. And as you can imagine, as the years go on, it will increase. There are some transition rules that give relief to some individuals, including those who have income below the tax filing threshold, coverage gaps of 3 months or less, incarcerated individuals, members of Indian tribes, those that would have been eligible for Medicaid under the expansion but live in a state that elected not to, and those for religious reasons or due to an unpredicted hardship. Any of those rules, you don't have to worry about the fine for not having health insurance. Any questions on any of that?
How does the individual mandate apply to the people under 26? So take my family, for example. I'm a family of 5. I'm the only income earner. So if, for example, one of my kids, we didn't have health care, or my wife or whatever, would the penalty kick on that person even though I had health care?
Yes.
So everything I just saw is times 5 for me?
Yes. For each individual, it's an individual mandate.
But if he has a family plan, they have health coverage.
Right, then you're fine. You're not fine because you have health insurance. But if they were uninsured, that fine goes to each individual person.
If his are dependents, the fine is his. So in other words, if he has children in college, like I do, age 21, and I have a single plan, but I'm not providing coverage for my college student, who gets the fine? The student or the student? What you were going to? The student.
The individual.
Okay. The individual.
Yep.
And now, right now, Pennsylvania still rejects expanded Medicaid, right?
I'm sorry?
We're still rejecting expanded Medicaid
Yes.
in Pennsylvania.
Yes. Are there any other questions on the individual mandate? I'd like to touch on what the health insurance exchanges are, or now the government has changed that terminology. They're now calling insurance marketplaces. There are two of them that are going to be available. It's the individual and shop. The shop is the exchange available for small employers. They're going to be available to be open October 1st, 2013 for effective dates of January 1st of 2014. Now that's for the individual exchange. The small employer exchange has been delayed until 2015. What happened when they came out and the government said that a state would have to have exchanges? There's three ways you could have the exchange. You could decide to run it as your state, have a state-run exchange. You could have the federal government run the exchange, or you could have a combination of both, the state and the federal government. There's going to be 26 states that have opted out and said that they would like the federal government to facilitate the exchange. Those include around us, Pennsylvania and Ohio. There's 17 state-run exchanges, which include New York and Maryland. There's 7 federal/state partnership exchanges, which include West Virginia and Delaware. Now, this gets into the 60% rule we were talking about of availability. It'll start to become a little bit clearer here on what the government considers the plans that are going to be offered on the exchange and their actuarial value. They go on the metallic examples. So for the bronze plan, that's 60% coverage. The silver plan, that's 70% coverage. Gold plan is 80% and platinum is 90%. What that means is if you have a plan, let's say in the bronze level, you would be responsible for 40% of the costs of your medical services. The insurance plan would pick up 60%. As I mentioned previously in our talk, we don't find many employers that even have a 90% plan. Most employers, they may have a high deductible. You may see some that do some co-insurance. So as you can imagine, for individuals, it's going to be quite a shock because they're going to now have a lot higher cost sharing that they might have been used to previously from their employer if they decide to go to the exchanges. Household incomes up to 4 times the federal poverty level can qualify for subsidies. The federal poverty level is currently $11,170 a year for an individual and $23,050 for a family of 4. So if you are an individual that makes up to $44,680 a year, you could still receive a subsidy to go to the exchange and purchase a product. If you're a family of 4 and you make up to $92,200 a year, you still could qualify for a subsidy and go purchase and be helped pay for a premium on the exchange. Individuals who would pay between 2% and 9% of income for a silver plan on the exchange.
But that's monthly?
Yes. No, I'm sorry, that's yearly. Right, Rick? Same? Yeah. Yeah, men's and men's.
Times a month or times a year, you know, depending on how you look at it.
Yeah, it would calculate to be the same. So when you're looking at the cost of the silver plan on the exchange, individuals would pay between 2% and 9% of income for that silver plan. So if they're closer to 4 times the poverty level, they're going to pay the 9.5% cost of the silver plan. For those individuals that would pay the 2% would be the ones that are closer to the federal poverty level. But it does not, and those individuals, let me back up. Individuals that would pay 2% of the cost of the silver plan on the exchange would be those individuals that are at the federal poverty level but don't qualify for Medicaid. Does that make sense? Is there any questions on any of the insurance marketplaces? Go ahead, Deb.
2 things. When we say 2% and 9% of income, are we talking gross or net?
Gross.
Okay, just want to clarify. And the other thing is, what happens where you have two, how do I say this? 2 people, both in under the shock, okay, divorcees with children, and the coordination of benefits between the primary and the secondary insurance. How does that come into play when you have 2 parents who are using the shop to pick these plans.
You have two, so let
You know what I'm talking about.
Let me digest this. So
You've got a husband and wife who are divorced.
okay,
Okay, both falling under the small employer exchange with dependent children.
okay.
And typically there's the primary insurance and the secondary insurance and the coordination of benefits between the two. What happens with that?
Are the dependents on the parents' plan?
Sure.
Okay.
Primary one with the, the first and
Yeah,
and
that's
where, how the heck do they even work
You
that?
can answer that for you in the back.
Let me try to take a shot at that. First of all, the SHOP is for employers.
Right.
Okay, SHOP is Small Employers Health Option Plan.
Uh-huh.
I don't know what happened to employers now.
That's
It's an
okay.
acronym. Okay, and what Mike was saying is there's a delay until 2015 on SHOP for mixed carrier plans. But for 2014, the SHOP's available to small employers on a single insurance company basis. Okay, so let's just put that aside for a minute.
Gotcha.
Now you're asking, like, we have individuals, we're on the individual mandate that we're talking about now, so all human beings that are U.S. citizens have to have coverage. The government doesn't care where they get it, through the employer, not through the employer. They're saying you, the individual, must prove to us, the government, is what they're saying, that you have at least 60% coverage. That's what they're really saying, if you really cut to the chase on it. So now your question is, and the government also says, I'm not in the family. Government says this is an employee mandate, or an individual mandate, excuse me. So it's a person. All right, so they're really just judging each person, whether they're 6 years old, whether they're 60 years old, whether they're married, divorced, or whatever. So now you march in and you're going to prove. You got your certification of insurance, right? So you have Johnny, 6 years old. The government says, where's Johnny's coverage? It's with mom, with dad. They don't care about anything else. They don't care about who's, as long as that person has 60% coverage somewhere, then it stops.
So
They don't
therefore,
care
the
about
shop isn't
Ford.
an issue as long as that individual has coverage through one or the other.
Yeah.
So they're,
SHOP is for employers owned, not individuals. It's-
Right,
It's
that-
for XYZ Construction Company to go, they're a member of a local, your local.
Mm-hmm.
They have a choice, under 50 to do nothing about insurance. There's no penalty, right,
Mm-hmm.
to the employer. Or if they decide to do some insurance, they also have no obligation on the level of coverage. There's no law there.
okay.
Okay, and at the end of the day, if you really think about it, employers under 50 really have no obligation to do much of anything under this law. But that individual that works at that company has a problem because they have to evidence coverage. So the way I'd like to explain it is that person has an opportunity to see if the employer will have that coverage for them and if they can afford it. Okay, or they can go to the public exchange or the private market on an individual policy basis, individual insurance. So you go to Highmark, go to Capital, go to Geisinger, and say, I just want to buy an individual policy. Did that help you?
Yeah, I think. I'm looking at,
Okay, can I just,
I get what you're saying now. It comes more down to
It
the
happens all the
individual
time. People get the
focus.
employer part
Yeah.
and the individual part commingled, and it really isn't. The
It's not.
employer is just a cafeteria, if you will, to go find the product. If there's no product available, or if it's not affordable or available over 50 live
Then it rolls up
employers,
basically
they
like
still
that.
have the obligation as an individual. They have to march off and figure out where to solve that
Gotcha.
problem. If they're low paid, they should run to the exchange, the public exchange, because they can get a subsidy. If they make less than $44,000 a year, or less than, Michael said, 92,200 and something, then in fact, they can get somebody else to pay part of the bill, the government. So that's a natural place to go, and it's the only place you can go to get a subsidy. You have to go to the public exchange.
Okay, thank you.
So SHOP is for employers in less than 50 that don't have to do anything but are choosing to offer something.
Right, they can offer their insurance through the shop
Okay.
exchange as an employer.
Okay.
Any other questions? Okay. I just want to go over some of the additional fees in 2014 changes. Additional fees imposed on insurance carriers expected to impact premiums by 2.3% in 2014 and by 3 to 4% in later years. This is projected to raise $60 billion over the next 6 years to help fund the act. There's the traditional reinsurance program assessment fee to finance reinsurance payments for individual market coverage, expected to cost about $63 per member per year, plus a small administrative fee. And that's for years 2014 through 2016, and they're looking to raise $25 billion in that time period. There's going to be annual fees on pharmaceutical manufacturers and medical devices, which may increase claim expense to your plan for 2011 and 2013, and they're looking to raise $47 billion by 2021. All this goes back to what I had mentioned, that we really believe with these fees it's going to be passed on to the rates. There is going to be out-of-pocket maximums for all non-grandfathered plans will be capped at the same level at which HSA plans are capped. In 2013, these levels are $6,250 for an employee-only coverage and $12,500 for family coverage. So what that would mean is the total out-of-pocket expense for an individual would not go higher than $6,250, and for a family would not go higher than $12,500. That would be your co-insurance, your deductibles, your co-pays, your total out-of-pocket expense, excluding premium. And I did touch on the waiting period can no longer exceed 90 days. 90 days is the max. This is very important for groups less than 50. There's changes that's happening to the marketplace, drastic changes. As you know, right now, if you have under 50 employees on a plan, each of your employees have to fill out a medical questionnaire and answer questions pertaining to themselves and any family members that are on the plan. And that's how the insurance carrier really develops a rate. That all goes away January 1st, 2014. Carriers can no longer ask medical questions and medically underwrite to develop rates. So we're going to go back to what we saw years ago. If you remember, Highmark was probably the last to start medically underwriting, would be community rating. Adjusted community rating and market restriction means that small group insurers will only be able to vary premiums by family size, geography, tobacco use and age, gender, industry, group size, health status, and medical history factors will be prohibited. Rates, yes, Christian.
What about payment history? So, for example, after we get into this a year or 2 or 3 or 5, we're going to have the history of how we did. Could our rates theoretically be lower than the Chambers plan or the plan down the street because we use less, our members use less healthcare service?
So you're basically saying if the claims of the pool perform better, could the rates go down? Is that
Yes,
your question?
that's the question, yes.
Yes, I would believe so. This is where it gets kind of crazy. I don't know if anyone's gotten a comparison from carriers right now that have already adjusted their proposals. Rates will be age-banded. And will be based age-banded, tobacco, non-tobacco, region, and zip code. You could have a group of 10, and depending where they fall in their age, and tobacco, non-tobacco use, 10 different rates within the group. Because they're now going to be age-banded. Let's say it's 35 to 40, 41 to 46. There potentially could be multiple different rates within your group. You know how now you get one rate for all your employees? Now that it's age-band and based on these factors, each individual could have a different rate, potentially. Deductibles may not exceed $2,000 for employee only or $4,000 for family. And the annual limitation for all non-grandfathered plans and qualified health plans in the small group market. So deductibles for an individual cannot exceed $2,000, and for a family cannot exceed $4,000. There's going to be a health insurance exchange user fee It's 3.5% of monthly premium for each plan in an exchange. Jim?
Is that fee applicable to private exchanges as well?
Yes, I believe it is.
So any exchange.
Rick, do you want to make that more clear? The health insurance exchange user fee, the 3.5% fee, is that just for the public exchanges? Public, I apologize, just the public.
Rates on a public exchange would be 3.5% higher than private purchase. It's kind of the government's extra money to roll.
My guess would be if the private exchange is a for-profit business, they'll look at that gap and imagine that their fees could be increased in order to still maintain the same costs on the federal exchange. So the point being that if there's a cost imposed on one, there'll probably be an opportunity, if it's a private exchange, to perhaps find a way, which gets into the next segment, while you're here, to fund the non-due revenue portion, which is a primary concern to CEOs in that regard.
Yeah, the insurance industry really wants to keep purchasing private, and that's their goal. So they're going to do everything in their power that they're allowed to do to keep a rate lower privately than on a public exchange. Having said that, under 50, rates have to be the same, public or private, relative to community rating. This handling fee of 3.5% would make it 103.5%.
Correct.
Okay. Premium.
Okay. All right.
The industry, insurance industry, will probably attempt, because they want to keep the purchase private, to be 3.5% cheaper going forward. So a lot of this stuff is very fluid right now, and the rates have not been announced relative to what does it cost to buy insurance on the public exchange. But they're running out of time to keep that a secret, because it has to be available by October 1st, that information. Remember that notice that everybody has to know about, where can I buy it, how much does it cost. So here we sit on July 25th, and they got about another month and a half to be secretive about it. They, whoever they are, I'm not implying the government or the private industry or whatever, but it has to be rolling out pretty soon.
Okay, there's also the risk adjustment programming fee. The goal is to spread the financial risk among the individual and small group insurers, shifting payments from those with relatively lower risk populations to those with higher risk populations. The way this has been told to me is through the law, when you're looking at the cost of insurance for an individual for their premium and the cost for a family rate. It can only be a 3-to-1 ratio, okay? So you have the individual premium, your family rate can only be 3 times the individual premium. You do have some carriers that do 5 times right now, the individual premium, okay? What we're basically saying here is what the insurance carrier is going to do is they're still going to want to make their money, right? So when they're judging their premiums, they're not going to go from the younger age premium and take it 3 times to the family. They're going to take it from the older population individual premium and take it 3 times to family. So essentially what you're going to see is you could have sicker groups having lower cost insurance in the younger groups, their premiums going up. And that's where we'll see the shift costs in the premiums. And then lastly, just a little bit of information that we know to date, because the law is changing pretty much every week. After 2014, there's going to be employer reporting required in 2015. And this is going to be information returns on each employee and the company plan information. It's going to help the government decide what the employee income is, what they're making, and also what type of plan the company is providing to those employees. Non-discrimination rules. In 1974, ERISA made non-discrimination rules exempt for fully insured plans. Basically, you did not have to have discrimination testing. So what you'll find with, in a lot of, particularly in our association that we work with, you could have family-owned businesses where, let's say that the son the owner, the wife, the daughter, all get a richer contribution or richer plan than compared to the other employees within the group, you no longer can do that because of PPACA. There would be discrimination testing. You cannot discriminate and provide an employee within the group a richer plan than another individual. They're called management carve-outs, if you've heard that before, where management receives richer benefits. So PPACA has removed that exemption for fully insured plans. The rules and regulations have not been established yet, and there'll be more to come out later this year in regards to non-discrimination rules. There's also going to be the automatic enrollment rules for groups that have 200 or more employees. What this means is right now, as we do business today, when you hire a new hire, you give them their benefit package, right? Their benefit package. They decide if they want to enroll in the plan or not. Well, how it's going to work in probably 2015 is if you have 200 or more employees, they're automatically enrolled. It's not them making a decision. They're automatically enrolled in the plan. And then they have to decide if they want to be in that plan after that. So it's basically the same, but it's just a different way of doing business. You have automatic enrollments for those groups that have over 200 employees. And then there is the excise tax on Cadillac group health plans. If the cost is more than $850 per month for employee-only coverage, or $2,292 per month for family coverage, the insurance company or plan administrator must pay an excise tax equal to 40% of the excess cost. So if you have a premium that's higher than $850 for an individual, you're going to be taxed 40% on whatever is over that $850. You think that's high? We actually, unfortunately, do see groups that have plans that cost more than $850 an individual, or $2,292 for a family. So, groups going to really have to consider of looking at some different options. And normally, we find these plans are your no deductible plans, your very rich plans that have these very high premiums. So that's where you're going to have to look into switching the costs, having higher deductible plans to lower premiums. Other than that, if there's any additional questions or anything that you wanted to be covered that myself or anyone from the JRG team can answer for you, I know we have just a couple minutes, and if we can't handle it now, like I said, we'll be here throughout the day and the whole weekend to answer any questions you might have. All right, thank you for your time. I appreciate it.